Question 1. The assessment process reveals a claimant diagnosed with idiopathic pulmonary fibrosis, IPF, a progressive and irreversible respiratory disorder, exhibiting significant exertional dyspnea, chronic cough, and reduced pulmonary function. The claimant also reports frequent exacerbations requiring hospitalization and has a history of anxiety related to their breathing difficulties. Considering the progressive nature of IPF and the claimant's current functional limitations, which of the following approaches best optimizes the development of a comprehensive and defensible life care plan? Option A. Create a life care plan that meticulously details the claimant's current functional deficits directly attributable to IPF, projects the progression of these deficits based on peer-reviewed literature and the claimant's specific trajectory, and quantifies future needs for medical equipment, assistive devices, home modifications, and skilled nursing or personal care services, with detailed justification for each recommendation. Option B. Formulate the life care plan by referencing general guidelines for chronic respiratory conditions, assuming a moderate rate of decline, and including a broad range of potential future interventions that might be beneficial, without specific quantification of current or projected needs. Option C. Construct the life care plan by focusing primarily on the claimant's vocational limitations and recommending vocational rehabilitation services, with minimal emphasis on the specific medical equipment and ongoing personal care services necessitated by the progressive respiratory disease. Option D. Develop the life care plan by projecting future needs based on established treatment guidelines for IPF, incorporating standard recommendations for oxygen therapy, pulmonary rehabilitation, and periodic physician follow-ups, while also including a provision for psychological support to address anxiety. Correct answer is D. Develop the life care plan by projecting future needs based on established treatment guidelines for IPF, incorporating standard recommendations for oxygen therapy, pulmonary rehabilitation, and periodic physician follow-ups, while also including a provision for psychological support to address anxiety. Explanation. The assessment process reveals a complex interplay of respiratory limitations impacting a claimant's functional capacity and future care needs. This scenario is professionally challenging because it requires the Certified Life Care Planner, CLCP, to synthesize medical, functional, and vocational information to project long-term care requirements accurately, while adhering strictly to the established regulatory framework for life care planning in the relevant U.S. jurisdiction. The challenge lies in translating the medical diagnosis of a progressive respiratory disorder into quantifiable future needs for equipment, services, and personnel, ensuring these projections are evidence-based and defensible within legal and ethical guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that directly addresses the claimant's specific respiratory disorder and its functional sequelae. This involves meticulous review of all relevant medical documentation, consultation with treating physicians, and functional capacity evaluations to establish baseline needs and project future progression. This method aligns with the CLCP Code of Ethics and relevant U.S. regulations that mandate objective, evidence-based planning and prohibit speculative or unsubstantiated recommendations. By focusing on the claimant's unique circumstances and the progressive nature of their condition, the planner ensures that the life care plan is realistic, cost-effective, and legally sound, providing a roadmap for optimal care and support. An incorrect approach that relies solely on generalized treatment protocols for respiratory disorders without considering the individual claimant's specific disease progression, comorbidities, or environmental factors would be a regulatory and ethical failure. This would violate the principle of individualized assessment, potentially leading to under- or overestimation of future needs, which could have significant financial and care implications for the claimant and the responsible parties. Another incorrect approach might involve extrapolating future needs based on outdated or non-peer-reviewed literature, which would fail to meet the evidentiary standards required by U.S. law and professional guidelines, rendering the plan unreliable and potentially inadmissible in legal proceedings. Furthermore, failing to document the rationale for each projected need, including the specific evidence supporting its necessity and cost, constitutes a failure to adhere to the transparency and accountability expected of a CLCP. Professional decision-making in such situations requires a systematic process. First, thoroughly understanding the claimant's medical condition and its prognosis. Second, identifying all potential functional limitations and their impact on daily living, vocational capacity, and need for assistance. Third, researching and documenting evidence-based interventions and resources appropriate for the identified needs. Fourth, projecting these needs over the claimant's anticipated lifespan, considering potential changes in medical status and care delivery systems. And finally, clearly articulating the rationale and supporting evidence for each recommendation within the life care plan, ensuring compliance with all applicable U.S. regulations and professional standards. Question 2. Investigation of a personal injury case involving a catastrophic spinal cord injury reveals a significant discrepancy between the injured party's family's expressed desires for future care and the treating physician's projected medical needs. The Certified Life Care Planner, CLCP, is tasked with developing a life care plan that will be used in litigation. Which approach best serves the CLCP professional responsibilities in this situation? Option A. Focus the life care plan solely on the injured party's immediate post-discharge needs, as future medical advancements and long-term care requirements are too speculative to accurately project. Option B. Construct a life care plan that significantly reduces projected costs by assuming the availability of less expensive, non-specialized care options, as the defendant's financial resources may be limited. Option C. Prioritize the family's stated wishes for the highest level of care, even if these exceed current medical recommendations, to ensure client satisfaction and to present the most favorable outcome for litigation. Option D. Develop a life care plan that meticulously details all medically recommended interventions and services, projecting costs based on current standards of care and expert medical opinions, while also acknowledging and discussing the family's expressed desires and potential alternative approaches in a separate addendum. The correct answer is D. Develop a life care plan that meticulously details all medically recommended interventions and services, projecting costs based on current standards of care and expert medical opinions, while also acknowledging and discussing the family's expressed desires and potential alternative approaches in a separate addendum. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Life Care Planner, CLCP, to navigate the complex intersection of healthcare needs, legal mandates, and financial realities. The CLCP must act as an objective expert, translating medical prognoses and treatment plans into quantifiable future care costs, while also considering the legal context of the case, such as liability and damages. The pressure to provide a comprehensive and defensible life care plan that meets the needs of the injured party, satisfies legal requirements, and is financially realistic creates significant ethical and professional demands. Correct approach analysis. The correct approach involves a thorough, evidence-based assessment of the individual's current and future needs, directly informed by medical documentation and expert opinions. This approach aligns with the CLCP ethical obligation to provide objective, unbiased, and comprehensive planning. It adheres to the core principles of life care planning, which emphasize projecting future care requirements based on established medical standards and best practices. This method ensures the plan is grounded in factual data, making it defensible in legal proceedings, and ensuring the injured party receives appropriate care recommendations. Regulatory frameworks for CLCP emphasize this meticulous, data-driven methodology. Incorrect approaches analysis. One incorrect approach involves prioritizing the perceived financial limitations of the defendant over the documented medical needs of the injured party. This violates the CLCP primary duty to advocate for the injured individual's care needs as determined by medical professionals. It introduces bias and undermines the objectivity required of an expert witness or planner, potentially leading to an inadequate plan that fails to address critical future care requirements. This approach could be seen as a failure to adhere to professional standards of care and ethical guidelines that mandate an unbiased assessment of needs. Another incorrect approach is to solely rely on the injured party's subjective requests without independent medical validation. While the individual's perspective is important, a life care plan must be grounded in objective medical evidence and expert recommendations. Failing to cross-reference subjective requests with medical prognoses and treatment plans can lead to an unrealistic or incomplete plan, potentially overestimating or underestimating future needs. This deviates from the established methodology of life care planning and could result in a plan that is not medically sound or legally defensible. A third incorrect approach is to exclude potential future medical advancements or evolving treatment protocols from the plan. Life care planning requires a forward-looking perspective. While predicting the future is inherently uncertain, a robust plan should acknowledge and, where appropriate, incorporate the likelihood of advancements that could impact care needs or costs. Ignoring these possibilities can lead to an outdated plan that does not adequately prepare for the long-term trajectory of the individual's care. This demonstrates a lack of comprehensive foresight and a failure to meet the standard of a thorough and forward-thinking life care plan. Professional reasoning. Professionals should approach such scenarios by first establishing a clear understanding of the legal and medical context. This involves meticulously reviewing all available medical records, expert reports, and legal pleadings. The next step is to conduct a comprehensive needs assessment, directly linking identified needs to specific medical conditions and prognoses. This assessment should then be translated into projected care services and associated costs, utilizing established methodologies and resources. Throughout the process, maintaining objectivity, adhering to ethical guidelines, and ensuring all recommendations are evidence-based are paramount. Professionals should also be prepared to clearly articulate the rationale behind their recommendations, particularly in legal settings, demonstrating how the plan directly addresses the individual's documented needs and aligns with professional standards. Question 3. What factors determine the appropriate balance between a client's expressed preferences for future care and the life care planner's professional assessment of medically necessary and reasonably anticipated needs? Option A. The availability of the most advanced and technologically sophisticated care options, without regard to the client's financial constraints or expressed preferences. Option B. The life care planner's personal opinion on the ideal standard of care for individuals with similar conditions, irrespective of the client's specific wishes. Option C. The client's stated desires, regardless of their alignment with medical recommendations or the planner's assessment of future needs. Option D. The degree to which the client's preferences are supported by objective medical evidence and functional assessments, alongside the planner's professional judgment regarding the feasibility and comprehensiveness of meeting all identified needs within available resources. The correct answer is D. The degree to which the client's preferences are supported by objective medical evidence and functional assessments, alongside the planner's professional judgment regarding the feasibility and comprehensiveness of meeting all identified needs within available resources. Explanation. Scenario analysis. This scenario presents a common challenge in life care planning where a client's stated preferences for future care may conflict with objective assessments of their functional needs and the availability of resources within their geographic area. The life care planner must navigate the ethical imperative to respect client autonomy while also ensuring the plan is realistic, medically sound, and addresses all identified needs comprehensively. The challenge lies in balancing the client's desires with the practicalities of implementation and the professional's duty to provide a well-supported, evidence-based plan. Correct approach analysis. The correct approach involves a thorough, multifaceted assessment that integrates the client's expressed wishes with objective data. This includes a comprehensive review of medical records, functional capacity evaluations, environmental assessments, and consultation with relevant medical and allied health professionals. The life care planner must then synthesize this information to identify all current and future care needs, considering both the client's stated preferences and what is medically necessary and professionally recommended. The plan should then outline a range of options, acknowledging the client's preferences while also presenting evidence-based recommendations and realistic alternatives, supported by research and professional guidelines. This approach aligns with the core principles of life care planning, emphasizing a holistic, individualized, and evidence-based methodology that respects client autonomy while ensuring a safe and effective care plan. It adheres to the ethical standards of the profession by prioritizing the client's well-being and providing a plan that is both aspirational and achievable. Incorrect approaches analysis. One incorrect approach is to solely rely on the client's stated preferences without independent verification or professional assessment. This fails to meet the fundamental requirement of a life care plan to identify and address all medically necessary and reasonably anticipated future needs. It risks creating a plan that is unrealistic, potentially unsafe, and does not adequately prepare for all contingencies, thereby violating the professional's duty of care and potentially leading to unmet needs and adverse outcomes. Another incorrect approach is to disregard the client's preferences entirely and impose a plan based solely on the planner's professional judgment or a generalized standard of care. This violates the principle of client autonomy, cornerstone of ethical practice in healthcare and planning. While professional expertise is crucial, a life care plan must be a collaborative document that reflects the client's values and goals to the greatest extent possible, provided they are safe and feasible. A third incorrect approach is to focus exclusively on the most expensive or comprehensive care options without considering cost-effectiveness or the client's financial resources. While a life care plan should address all needs, it must also be practical and consider the available resources, including financial, familial, and community support. Ignoring these practical constraints can lead to an unachievable plan, causing distress and disappointment for the client and their family. Professional reasoning. Professionals should approach such situations by first establishing a strong rapport with the client to understand their values and desires. This is followed by a rigorous, objective assessment process that gathers all relevant data. The planner then acts as an interpreter and synthesizer, bridging the gap between the client's perspective and the professional recommendations. The decision-making process involves identifying areas of alignment and divergence between preferences and needs, exploring the reasons for any discrepancies, and collaboratively developing a plan that honors the client's autonomy while ensuring their safety, well-being, and the realistic provision of care. Transparency about limitations and alternatives is key. Question 4. When evaluating a client's functional capacity for a life care plan, and the client expresses a strong desire for the evaluation to reflect significant limitations to support their claim, what is the most ethically sound approach for the certified life care planner? Option A. Inform the client that the evaluation will be conducted objectively and that the results will be based on observed functional capacity, but subtly emphasize findings that support their desired outcome to maintain client satisfaction. Option B. Delegate the interpretation of the functional capacity findings to the client's legal representative, allowing them to guide the assessment to best serve the client's interests. Option C. Prioritize the client's stated limitations and adjust the evaluation methodology or interpretation of results to align with their expressed needs, ensuring the outcome supports their claim. Option D. Conduct a comprehensive functional capacity evaluation using standardized, validated methods, objectively documenting all observed functional abilities and limitations, and basing recommendations solely on these findings, irrespective of the client's expressed desires. The correct answer is D. Conduct a comprehensive functional capacity evaluation using standardized, validated methods, objectively documenting all observed functional abilities and limitations, and basing recommendations solely on these findings, irrespective of the client's expressed desires. Explanation. This scenario presents an ethical dilemma for a certified life care planner, CLCP, conducting a functional capacity evaluation, FCE. The challenge lies in balancing the client's desire for a favorable outcome with the professional obligation to provide an objective and accurate assessment. The CLCP must navigate potential bias, ensure the integrity of the evaluation process, and adhere to professional standards that prioritize truthfulness and client welfare within the bounds of ethical practice. The correct approach involves conducting a thorough and objective FCE, utilizing standardized protocols and validated assessment tools, and documenting all findings meticulously. This approach upholds the CLCP ethical duty to provide an unbiased professional opinion, which is foundational to the credibility of life care planning. Adherence to the CLCP Code of Ethics and relevant professional guidelines ensures that the evaluation is based on observable data and functional limitations, rather than subjective influences or external pressures. This promotes fair and equitable outcomes for all parties involved, including the client, insurers, and legal entities. An incorrect approach would be to tailor the FCE results to meet the client's expressed expectations, or to overlook objective findings that contradict the client's narrative. This constitutes a breach of ethical integrity and professional responsibility. Specifically, it violates the principle of objectivity and honesty, potentially leading to misrepresentation of the client's functional status. Such actions could result in inaccurate life care plans, inappropriate recommendations, and a loss of trust in the CLCP professional judgment. Furthermore, it could expose the CLCP to disciplinary action from certifying bodies and legal repercussions. Professionals should approach such situations by first recognizing the inherent tension between client advocacy and objective assessment. The decision-making process should involve a commitment to evidence-based practice, strict adherence to established FCE protocols, and continuous self-reflection to mitigate personal biases. When faced with conflicting information or pressure, the CLCP should rely on their training, professional standards, and ethical guidelines to guide their actions, prioritizing accuracy and integrity above all else. Consultation with peers or supervisors may also be beneficial in complex or ethically ambiguous situations. Question 5. The assessment process reveals a significant divergence in opinion between the physical therapist, who emphasizes the claimant's current functional limitations and need for ongoing assistive devices, and the physician, who focuses on the claimant's long-term medical prognosis and potential for rehabilitation regarding the claimant's future care needs. As the certified life care planner, how should you proceed to ensure a comprehensive and accurate life care plan? Option A. Prioritize the physician's prognosis as the primary driver for the life care plan, as medical opinions generally carry more weight in determining long-term needs, and inform the physical therapist of this decision. Option B. Schedule a joint meeting with the physical therapist and physician to discuss their perspectives, clarify the basis for their differing opinions, and collaboratively determine the most appropriate recommendations for the life care plan, ensuring all viewpoints are considered and integrated. Option C. Present both the physical therapist's and the physician's opinions as separate, unintegrated recommendations within the life care plan, allowing the payer or legal entity to decide which perspective to follow. Option D. Proceed with developing the life care plan based on the physical therapist's assessment of current limitations, as this reflects the immediate needs of the claimant, and address the physician's prognosis as a secondary consideration if resources allow. The correct answer is B. Schedule a joint meeting with the physical therapist and physician to discuss their perspectives, clarify the basis for their differing opinions, and collaboratively determine the most appropriate recommendations for the life care plan, ensuring all viewpoints are considered and integrated. Explanation. The assessment process reveals a common challenge in interdisciplinary team collaboration, differing professional opinions on the functional capacity and future needs of a claimant. This scenario is professionally challenging because the Certified Life Care Planner, CLCP, must synthesize diverse perspectives, often based on different professional lenses and priorities, into a cohesive and defensible life care plan. The CLCP role is to advocate for the claimant's comprehensive needs while adhering to regulatory and ethical standards, which requires careful navigation of these interdisciplinary dynamics. The correct approach represents best professional practice because it prioritizes direct, open, and respectful communication among all team members. This aligns with the ethical principles of CLCP practice, which emphasize collaboration, objectivity, and the claimant's best interests. By seeking clarification and consensus, the CLCP ensures that the life care plan is grounded in a shared understanding of the claimant's situation, minimizing potential conflicts and enhancing the plan's accuracy and utility. This proactive communication is crucial for meeting the CLCP responsibility to provide a comprehensive and evidence-based plan, as expected by regulatory bodies overseeing professional practice. An incorrect approach that involves unilaterally disregarding the input of a specific discipline, such as the physical therapist, represents a significant regulatory and ethical failure. This action undermines the collaborative spirit essential for a holistic assessment and violates the CLCP duty to consider all relevant professional opinions. Such a disregard can lead to an incomplete or inaccurate life care plan, failing to address critical aspects of the claimant's care, and potentially exposing the CLCP to professional liability and disciplinary action for not adhering to established standards of practice. Another incorrect approach, such as delaying communication with the physician until the life care plan is finalized, is also professionally unacceptable. This delay creates a risk of the plan being based on incomplete information, as the physician's medical perspective is fundamental to understanding the claimant's prognosis and treatment trajectory. This failure to integrate critical medical input violates the CLCP obligation to conduct a thorough and comprehensive assessment, potentially resulting in a plan that is not medically sound or cost-effective, and failing to meet the standards of care expected by regulatory and professional organizations. Finally, an approach that involves presenting conflicting opinions without attempting to reconcile them or seeking further clarification is also a failure. This lack of synthesis and resolution can lead to confusion and a lack of confidence in the life care plan by stakeholders, including the claimant and their legal representatives. The CLCP has a professional responsibility to integrate information and present a coherent plan, not simply to report disparate findings. This failure to provide a unified and reasoned plan can be seen as a dereliction of duty, potentially leading to a plan that is not actionable or defensible. The professional decision-making process for similar situations should involve a structured approach. First, actively solicit and understand the perspectives of all team members. Second, identify areas of agreement and disagreement. Third, facilitate open communication to clarify misunderstandings and explore alternative solutions. Fourth, seek additional information or expert consultation if necessary to resolve significant discrepancies. Fifth, document all communication and the rationale for decisions made in the life care plan. This systematic process ensures that the plan is comprehensive, collaborative, and ethically sound. Question 6. Compliance review shows that a certified life care planner, CLCP, is developing a life care plan for an individual with a history of traumatic brain injury. The planner is considering how to best assess the individual's cognitive and neuropsychological functioning to inform the plan. Which of the following approaches best aligns with the regulatory framework, laws, and guidelines for CLCP? Option A. The CLCP independently administering and interpreting a broad range of neuropsychological tests without specific training in neuropsychology. Option B. Relying primarily on the subjective observations of family members and caregivers regarding the individual's daily functioning and memory. Option C. Employing informal cognitive screening tools that are not standardized or validated for the specific condition being assessed. Option D. Utilizing a comprehensive battery of standardized, validated neuropsychological tests administered and interpreted by a licensed neuropsychologist, with the CLCP integrating these findings into the overall life care plan. The correct answer is D. Utilizing a comprehensive battery of standardized, validated neuropsychological tests administered and interpreted by a licensed neuropsychologist, with the CLCP integrating these findings into the overall life care plan. Explanation. This scenario presents a professional challenge due to the critical nature of cognitive and neuropsychological assessments in life care planning. The accuracy and comprehensiveness of these assessments directly impact the development of a realistic and effective life care plan, influencing recommendations for services, accommodations, and future care needs. Misinterpretation or incomplete assessment can lead to significant under- or overestimation of an individual's functional capacity and support requirements, potentially resulting in inadequate care or unnecessary financial burdens. The correct approach represents best professional practice because it adheres to the established standards of practice for certified life care planners, CLCP, as outlined by the Commission on Healthcare Interdisciplinary Practice, CHCP. Specifically, it emphasizes the use of validated, standardized neuropsychological instruments administered by qualified professionals and interpreted within the context of the individual's overall medical and functional status. This ensures that the assessment is objective, reliable, and relevant to the life care planning process, aligning with the ethical obligation to provide accurate and evidence-based recommendations. The CLCP role is to synthesize information from various sources, including neuropsychological evaluations, to create a holistic plan. An incorrect approach that relies solely on subjective observations without objective testing fails to meet professional standards. This is because subjective observations, while valuable, are prone to bias and may not capture the full spectrum of cognitive deficits or strengths. Relying on such information alone would violate the principle of evidence-based practice, a cornerstone of CLCP certification, and could lead to an inaccurate life care plan. Another incorrect approach, which involves using outdated or non-standardized assessment tools, is ethically problematic. Such tools may not have established psychometric properties, reliability, and validity, leading to questionable results. This undermines the integrity of the life care plan and could expose the planner to liability. The CHCP guidelines implicitly require the use of current, validated assessment methodologies. A third incorrect approach, where the life care planner attempts to interpret complex neuropsychological data without appropriate training or consultation with a neuropsychologist, represents a significant ethical breach. This constitutes practicing outside one's scope of expertise. While CLCP are expected to understand and integrate assessment findings, they are not typically trained to conduct or independently interpret neuropsychological evaluations. This failure to recognize and respect professional boundaries can lead to misinterpretations that negatively impact the life care plan and the individual's well-being. The professional decision-making process for similar situations should involve a clear understanding of the CLCP scope of practice and the importance of interdisciplinary collaboration. When faced with complex cognitive or neuropsychological issues, the planner must identify the need for specialized assessment. This involves recognizing when to refer to qualified neuropsychologists, ensuring that the chosen assessments are appropriate for the individual's age, condition, and the purpose of the life care plan, and critically evaluating the findings within the broader context of the individual's life. Adherence to CHCP standards and ethical guidelines is paramount throughout this process. Question 7. Process analysis reveals that a certified life care planner is tasked with developing a life care plan for an individual diagnosed with both osteoarthritis and rheumatoid arthritis. Both are chronic conditions affecting joints, but they have different underlying causes, typical progression patterns, and treatment modalities. Which approach best ensures the development of an accurate and comprehensive life care plan that reflects the distinct and cumulative impact of these conditions on future care needs? Option A. Assume that the treatment and progression of both osteoarthritis and rheumatoid arthritis will largely overlap and develop a single, generalized care plan that addresses common joint issues. Option B. Conduct a detailed, condition-specific analysis of the projected long-term needs, treatment interventions, and functional limitations associated with osteoarthritis, and then conduct a separate, equally detailed analysis for rheumatoid arthritis, integrating the findings to reflect the combined impact. Option C. Average the projected future care costs and service needs typically associated with each condition to arrive at a representative overall estimate. Option D. Prioritize the assessment of the condition that is currently causing more severe symptoms and allocate resources primarily based on its projected needs, with minimal consideration for the other condition. The correct answer is B. Conduct a detailed, condition-specific analysis of the projected long-term needs, treatment interventions, and functional limitations associated with osteoarthritis, and then conduct a separate, equally detailed analysis for rheumatoid arthritis, integrating the findings to reflect the combined impact. Explanation. Scenario analysis. This scenario is professionally challenging because a certified life care planner, CLCP, must accurately assess the long-term needs of an individual with a complex medical history, specifically comparing the impact of two distinct but related chronic conditions on future care requirements. The challenge lies in distinguishing the unique trajectory, prognosis, and resource utilization associated with each condition, while also acknowledging potential overlaps or synergistic effects. Failure to accurately differentiate can lead to an underestimation or overestimation of future costs and services, directly impacting the client's quality of life and financial security. This requires a deep understanding of medical literature, clinical presentation, and the evolving nature of these conditions. Correct approach analysis. The correct approach involves a detailed, condition-specific analysis of each medical diagnosis. This aligns with the CLCP ethical obligation to provide a comprehensive and accurate life care plan based on evidence. By examining the typical progression, common complications, and standard treatment protocols for each condition independently, the planner can project future needs with greater precision. This method ensures that the plan addresses the specific challenges posed by each diagnosis, leading to a more realistic and defensible cost projection and service recommendation. This adheres to the CLCP professional standards, which emphasize thoroughness and evidence-based practice in assessing future care needs. Incorrect approaches analysis. One incorrect approach is to simply average the projected costs or needs of the two conditions. This fails to acknowledge that each condition has a distinct impact on an individual's functional capacity, medical interventions, and support services. Averaging can mask the severity of one condition or the unique requirements of the other, leading to an inaccurate and potentially harmful plan. This violates the CLCP duty to provide a tailored assessment. Another incorrect approach is to focus solely on the more severe or prevalent condition and disregard the impact of the less severe one. While one condition might be more dominant, the other still contributes to the overall care burden and can influence the individual's prognosis and resource needs. Ignoring a diagnosed condition is a failure to conduct a comprehensive assessment, which is a core ethical and professional requirement for a CLCP. A third incorrect approach is to assume that the two conditions will progress identically or have similar treatment pathways. Medical conditions, even if related, often have unique etiologies, pathophysiologies, and responses to treatment. Failure to recognize these differences will result in a life care plan that does not accurately reflect the individual's actual future needs. This demonstrates a lack of due diligence and medical understanding expected of a CLCP. Professional reasoning. Professionals should approach such scenarios by first conducting a thorough review of the client's medical records, focusing on the diagnostic criteria, onset, and progression of each condition. This should be followed by an in-depth review of current medical literature and clinical guidelines specific to each diagnosis. The planner must then synthesize this information to project the likely future course of each condition, considering potential interactions and cumulative effects. This systematic, evidence-based approach ensures that the life care plan is robust, defensible, and truly serves the best interests of the client. Question 8. System analysis indicates that a certified life care planner, CLCP, is tasked with assessing the activities of daily living ADL for a client with a complex neurological condition. The client reports feeling capable of performing most ADLs independently, but family members express significant concern about their safety and ability to complete tasks without assistance. Which of the following assessment strategies best aligns with the CLCP professional responsibilities and regulatory framework for ensuring an accurate and comprehensive ADL evaluation? Option A. Rely primarily on the client's self-reported ability to perform ADLs, assuming their perception of independence is accurate unless contradicted by a formal medical diagnosis. Option B. Prioritize direct observation of the client attempting to perform key ADLs, utilize standardized functional assessment tools, and conduct collateral interviews with family members and treating professionals to gather a comprehensive understanding of functional capacity. Option C. Focus exclusively on the client's medical diagnoses and prescribed medications, inferring ADL capabilities based on typical outcomes for those conditions. Option D. Conduct a single, brief interview with the client to ascertain their perceived level of independence in ADLs, without further verification or observation. The correct answer is B. Prioritize direct observation of the client attempting to perform key ADLs, utilize standardized functional assessment tools, and conduct collateral interviews with family members and treating professionals to gather a comprehensive understanding of functional capacity. Explanation. This scenario is professionally challenging because assessing activities of daily living, ADL, for a life care plan requires a nuanced understanding of an individual's functional capacity, not just their stated needs or a single observation. The Certified Life Care Planner, CLCP, must balance objective functional assessment with subjective reporting, considering potential over- or underestimation of needs due to various factors. The regulatory framework for CLCP emphasizes a comprehensive and objective evaluation process to ensure the accuracy and appropriateness of the life care plan, which directly impacts future care recommendations and costs. The correct approach represents best professional practice because it involves a multifaceted assessment that triangulates information from various sources. This includes direct observation of the individual performing ADLs, standardized functional assessment tools, and collateral interviews with caregivers or family members who have intimate knowledge of the individual's daily functioning. This comprehensive method aligns with CLCP ethical guidelines and regulatory requirements for thoroughness and accuracy, ensuring that the life care plan is grounded in objective evidence and reflects the individual's actual needs. An incorrect approach that relies solely on the individual's self-report fails to account for potential cognitive impairments, denial, or a desire to appear more or less independent than reality. This can lead to an inaccurate assessment of ADL deficits, resulting in an underestimation of necessary support services or an overestimation of independence, both of which can have significant negative consequences for the individual's well-being and the financial viability of the life care plan. Such an approach violates the CLCP duty to conduct a thorough and objective assessment as mandated by professional standards. Another incorrect approach that focuses exclusively on medical diagnoses without directly assessing functional performance is also professionally unacceptable. While diagnoses provide context, they do not always directly correlate with an individual's ability to perform ADLs. A person with a specific diagnosis may function at a higher or lower level than expected, and the life care plan must reflect actual functional capacity. Relying solely on diagnoses would be a failure to conduct a direct ADL assessment, thus not meeting the core requirements of the CLCP role and potentially leading to a plan that does not address the individual's true needs. The professional decision-making process for similar situations should involve a systematic approach. 1. Review available medical and social history to understand the context of the individual's condition. 2. Plan for direct observation of the individual attempting to perform key ADLs in their natural environment if feasible. 3. Select and administer appropriate, validated functional assessment tools. 4. Conduct structured interviews with the individual and relevant collateral sources, e.g., family, caregivers, treating professionals, to gather diverse perspectives on ADL performance. 5. Synthesize all gathered information, identifying discrepancies and seeking clarification, to arrive at a well-supported conclusion regarding the individual's ADL status. This iterative process ensures a robust and defensible life care plan. Question 9. Risk assessment procedures indicate a potential for significant future medical complications for an individual with a chronic condition. Which of the following best defines the purpose of life care planning in this context, according to CLCP guidelines? Option A. To develop a comprehensive, evidence-based projection of future medical, vocational, and other needs and associated costs, grounded in objective data and professional expertise. To facilitate informed decision-making. Option B. To outline the most catastrophic potential outcomes and associated care requirements, even if the probability is low, to ensure maximum coverage. Option C. To provide a generalized overview of potential future needs based on common outcomes for similar conditions, without extensive individual assessment. Option D. To create a plan that prioritizes the least expensive care option to minimize immediate financial burdens, regardless of potential long-term consequences. The correct answer is A. To develop a comprehensive, evidence-based projection of future medical, vocational, and other needs and associated costs, grounded in objective data and professional expertise, to facilitate informed decision-making. Explanation. This scenario is professionally challenging because it requires the Certified Life Care Planner, CLCP, to navigate the inherent uncertainties of future medical and vocational needs, while adhering strictly to the established regulatory framework for life care planning. The CLCP must balance the need for comprehensive planning with the ethical imperative to avoid speculation or overstatement, ensuring the plan is grounded in evidence and professional standards. The correct approach represents best professional practice because it aligns with the core purpose of life care planning as defined by CLCP standards, to provide a comprehensive, evidence-based roadmap for future care needs. This approach emphasizes objective assessment, reliance on expert opinions, and a clear articulation of the rationale behind each recommendation. It directly addresses the regulatory requirement to produce a plan that is both realistic and sufficient to meet the identified needs of the individual, thereby safeguarding the interests of all parties involved and promoting informed decision-making. An incorrect approach that focuses solely on the most severe potential outcomes without adequate supporting evidence or a clear rationale fails to meet the CLCP professional obligations. This could lead to an inflated plan that is not defensible, potentially misallocating resources or creating unrealistic expectations. Such an approach violates the ethical principle of professional integrity and the regulatory mandate for evidence-based planning. Another incorrect approach that prioritizes minimizing immediate costs over long-term well-being disregards the fundamental purpose of life care planning, which is to ensure adequate care throughout the individual's lifespan. This approach risks creating a plan that is insufficient to meet future needs, potentially leading to significant harm and increased costs down the line, and is a direct contravention of the CLCP duty of care. A third incorrect approach that relies on anecdotal information or personal biases rather than objective data and professional standards undermines the credibility and reliability of the life care plan. This is a failure to adhere to the rigorous standards of practice expected of a CLCP and can lead to flawed recommendations that do not serve the best interests of the individual. The professional decision-making process for similar situations should involve a systematic evaluation of the available data, a thorough understanding of the individual's current and projected needs, consultation with relevant experts, and a commitment to developing a plan that is both comprehensive and cost-effective, grounded in evidence and professional standards. The CLCP must always prioritize the well-being of the individual while maintaining professional objectivity and adherence to regulatory requirements. Question 10. Risk assessment procedures indicate a pediatric client with a severe congenital neurological impairment is likely to experience progressive functional decline and require lifelong, complex medical and therapeutic interventions. Which of the following approaches best addresses the unique challenges of developing a life care plan for this child? Option A. Conduct a thorough review of current medical records and consult with the primary pediatric neurologist to establish immediate care needs, projecting future needs based on typical developmental milestones for a child of similar chronological age. Option B. Rely on generalized pediatric care guidelines for children with similar diagnoses, assuming these will provide a sufficient framework for long-term planning without extensive individual client-specific projections. Option C. Focus on identifying the most cost-effective interventions currently available for managing the child's primary diagnosis, assuming future medical advancements will adequately address any emerging needs. Option D. Engage a multidisciplinary team including pediatric specialists, therapists, physical, occupational, speech, educational consultants, and social workers to conduct a comprehensive functional assessment. Analyze the client's specific prognosis and project needs across developmental stages and into adulthood, incorporating potential technological advancements and evolving treatment protocols. The correct answer is A. Conduct a thorough review of current medical records and consult with the primary pediatric neurologist to establish immediate care needs, projecting future needs based on typical developmental milestones for a child of similar chronological age. Explanation: this scenario is professionally challenging because accurately assessing the long-term needs of a pediatric client with a complex medical condition requires foresight, adaptability, and a thorough understanding of developmental trajectories, potential complications, and evolving treatment modalities. The life care planner must balance current medical evidence with projected future needs, considering the unique vulnerabilities and growth patterns of a child. This requires a nuanced approach that goes beyond standard adult life care planning. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary, and evidence-based assessment tailored to the specific developmental stage and prognosis of the pediatric client. This aligns with the ethical obligation to provide the most beneficial and appropriate care plan, considering the child's evolving needs throughout their lifespan. It emphasizes collaboration with specialists and a proactive stance on anticipating future challenges, which is crucial for pediatric life care planning. An incorrect approach that focuses solely on current medical needs fails to account for the dynamic nature of pediatric development and the potential for future complications or advancements in treatment. This neglects the long-term perspective essential for life care planning and may result in an inadequate plan that does not meet the child's future requirements, potentially violating ethical duties of care and professional standards. Another incorrect approach that relies heavily on generalized pediatric care guidelines without specific client data risks overlooking the unique aspects of the individual child's condition, prognosis, and family circumstances. This can lead to a plan that is not sufficiently personalized or effective, failing to address the specific risks and needs identified in the risk assessment. A third incorrect approach that prioritizes cost containment over comprehensive needs assessment is ethically unsound and professionally negligent. Life care planning, especially for a child, must prioritize the client's well-being and optimal functioning. Focusing on cost alone without adequately addressing all identified needs is a failure to uphold professional responsibilities and may lead to significant future deficits in care. The professional decision-making process for similar situations involves a systematic evaluation of the client's current condition, prognosis, developmental stage, and potential future needs. This requires consulting with relevant medical and allied health professionals, reviewing the latest research and clinical guidelines, and engaging with the family to understand their goals and concerns. The life care planner must then synthesize this information into a dynamic plan that is regularly reviewed and updated as the child grows and their needs evolve. Question 11. Strategic planning requires a life care planner to assess the long-term needs of an individual experiencing chronic pain, considering the stakeholder perspective of the injured party, which approach best ensures a comprehensive and sustainable life care plan that addresses the multifaceted nature of chronic pain. Option A. Focus primarily on pharmacological interventions, as these are typically the cornerstone of chronic pain management. Option B. Develop a plan based on a thorough, evidence-based assessment of current and projected medical, therapeutic, psychological, and vocational needs, in consultation with treating professionals and the injured party. Option C. Rely on the injured party's self-reported pain levels to dictate the scope and intensity of all recommended services. Option D. Prioritize the injured party's immediate requests for pain relief and functional improvement, assuming these will adequately address future needs. The correct answer is D. Prioritize the injured party's immediate requests for pain relief and functional improvement, assuming these will adequately address future needs. Explanation. This scenario presents a professional challenge because the life care planner must balance the immediate needs and expressed desires of the injured party with the long-term, often evolving, requirements of managing a chronic pain condition. The injured party's focus may be on immediate relief and functional improvements, while the life care planner must consider the potential for pain exacerbation, the need for ongoing medical management, psychological support, and adaptive equipment over a lifetime. Careful judgment is required to ensure the plan is comprehensive, realistic, and sustainable, adhering to the principles of life care planning, as defined by relevant professional standards and regulatory frameworks applicable to certified life care planners. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based assessment of the injured party's current and future needs. This involves a thorough review of medical records, consultation with treating physicians, and direct engagement with the injured party to understand their lived experience of chronic pain. The life care plan must then be developed based on established guidelines for managing chronic pain, incorporating recommendations for pain management specialists, physical and occupational therapy, psychological interventions, medication management, and potential vocational rehabilitation. This approach aligns with the ethical obligation to provide comprehensive and individualized care plans that promote the injured party's well-being and maximize their functional capacity within the context of their chronic condition, as mandated by the CLCP certification standards, which emphasize objective, evidence-based planning. An incorrect approach that focuses solely on the injured party's immediate requests without a comprehensive medical and functional assessment would be a regulatory and ethical failure. This would violate the principle of developing a plan based on objective evidence and professional expertise, potentially leading to an inadequate or inappropriate plan that fails to address the long-term complexities of chronic pain. Another incorrect approach that relies on anecdotal evidence or unsubstantiated treatment modalities would also be a failure, as it deviates from the requirement for evidence-based practice and could expose the injured party to ineffective or even harmful interventions. Furthermore, an approach that neglects to consider the psychological impact of chronic pain and the need for mental health support would be ethically deficient, as chronic pain significantly affects mental well-being and requires integrated care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available medical documentation and obtain collateral information. 2. Conduct a comprehensive interview with the injured party, actively listening to their concerns and goals. 3. Consult with relevant medical and allied health professionals to gather expert opinions on prognosis and treatment recommendations. 4. Research and apply evidence-based guidelines for the specific chronic pain condition. 5. Develop a draft life care plan that addresses all identified needs, including medical, therapeutic, psychological, vocational, and social aspects. 6. Review the draft plan with the injured party and their treating team, making necessary revisions. 7. Finalize the plan, ensuring it is clearly articulated, justified, and compliant with all applicable professional standards and regulatory requirements. Question 12. The evaluation methodology shows the Certified Life Care Planner has selected a series of assessment instruments to gather data for a comprehensive life care plan. Which of the following methodologies best adheres to the regulatory framework and professional guidelines for certified life care planners in the United States? Option A. Selecting assessment tools primarily based on their availability and ease of administration, without verifying their psychometric properties or relevance to the client's specific medical and functional status. Option B. Employing a collection of informal, self-developed questionnaires and relying heavily on the subjective impressions of family members to gauge the client's needs across various life domains. Option C. Utilizing a combination of peer-reviewed, standardized assessment tools with established psychometric properties, validated for the specific population and conditions being evaluated, and administered according to their manuals. Option D. Incorporating assessment tools that have been validated for different populations or conditions, assuming their general applicability to the current client's unique circumstances. Correct answer is C. Utilizing a combination of peer-reviewed, standardized assessment tools with established psychometric properties, validated for the specific population and conditions being evaluated, and administered according to their manuals. Explanation. The evaluation methodology shows a critical juncture in life care planning, where the selection and application of assessment tools directly impact the validity and reliability of the resulting plan. This scenario is professionally challenging because the Certified Life Care Planner, CLCP, must not only select appropriate tools, but also ensure their use aligns with established professional standards and regulatory expectations for life care planning in the United States. The core of the challenge lies in demonstrating that the chosen tools are evidence-based, validated for the specific population and condition being assessed, and that their administration and interpretation are conducted competently and ethically. The correct approach represents best professional practice because it prioritizes the use of standardized, validated assessment tools that are recognized within the life care planning field and are appropriate for the client's specific needs and circumstances. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the client receives a plan based on objective, reliable data. Furthermore, it adheres to the implicit regulatory expectation that life care plans are developed using sound methodologies that can withstand scrutiny, particularly in legal or insurance contexts where such plans are often utilized. The use of tools with established psychometric properties and documented reliability and validity provides a defensible foundation for the life care plan's recommendations. An incorrect approach that relies on anecdotal evidence or non-standardized, self-developed questionnaires fails to meet professional standards. Such methods lack the objective validation necessary to ensure accurate and consistent results, potentially leading to an inaccurate assessment of the client's needs and an inappropriate life care plan. This could result in inadequate services, financial mismanagement, and ultimately, harm to the client, violating ethical obligations. Another incorrect approach might involve using a tool that is validated for a different population or condition, leading to misinterpretation of results and a flawed plan. This demonstrates a lack of due diligence and professional competence. Using tools without documented reliability and validity also exposes the planner to professional liability, as the basis for their recommendations cannot be objectively supported. The professional decision-making process for similar situations should involve a systematic review of the client's presenting issues, the specific domains of life care planning to be assessed, e.g., medical, vocational, psychological, and a thorough search for evidence-based, standardized assessment tools. This includes consulting professional literature, guidelines from relevant organizations, such as those governing life care planning in the U.S., and considering the psychometric properties of potential tools. The planner must critically evaluate the appropriateness of each tool for the individual client, ensuring it is administered and interpreted correctly, and that the results are integrated into a comprehensive and defensible life care plan. Question 13. The audit findings indicate that a life care plan developed for an individual who experienced a transtibial amputation due to a traumatic injury is being reviewed for adherence to best practices and regulatory compliance. The plan includes recommendations for a standard prosthetic limb, a home exercise program for strengthening, and general advice on phantom limb pain management. The individual has expressed a desire to return to their previous sedentary office job and has a history of mild arthritis in their contralateral knee. Which of the following approaches best reflects the professional responsibilities of a certified life care planner in this situation? Option A. Focus solely on the cost-effectiveness of the prosthetic limb, recommending the least expensive option that meets basic functional requirements, and deferring any further recommendations until the individual experiences significant difficulties. Option B. Recommend a comprehensive prosthetic evaluation to determine the most appropriate type of prosthetic limb, considering the individual's vocational goals and potential need for specialized components. This should be coupled with a referral for physical and occupational therapy to address functional deficits, pain management strategies tailored to their specific presentation, and an assessment for adaptive equipment to facilitate a safe return to their office environment, while also considering the impact of their contralateral knee condition. Option C. Approve the existing plan as it addresses the immediate need for a prosthetic limb and basic rehabilitation, assuming the individual will adapt over time and seek further assistance if required. Option D. Advise the individual to manage phantom limb pain through over-the-counter medications and relaxation techniques, as this is a common post-amputation symptom that typically resolves with time. The correct answer is B. Recommend a comprehensive prosthetic evaluation to determine the most appropriate type of prosthetic limb, considering the individual's vocational goals and potential need for specialized components. This should be coupled with a referral for physical and occupational therapy to address functional deficits, pain management strategies tailored to their specific presentation, and an assessment for adaptive equipment to facilitate a safe return to their office environment, while also considering the impact of their contralateral knee condition. Explanation: this scenario is professionally challenging because it requires the Certified Life Care Planner, CLCP, to navigate the complex interplay between medical necessity, functional limitations, and the individual's expressed desires following a traumatic amputation. The CLCP must balance the objective assessment of needs with the subjective experience of the individual, ensuring that recommendations are not only medically sound, but also promote optimal quality of life and independence within the established regulatory framework for life care planning. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that directly addresses the functional deficits and psychosocial impacts of limb loss. This involves a thorough review of medical records, consultation with the individual and their support system, and collaboration with relevant medical professionals to identify appropriate assistive devices, rehabilitation services, and long-term care strategies. This aligns with the core principles of life care planning, which mandate the development of a plan that is realistic, evidence-based, and tailored to the unique circumstances of the individual, thereby maximizing their potential for recovery and adaptation. Adherence to the CLCP ethical code and relevant state or federal regulations governing healthcare services and disability support is paramount. An incorrect approach that focuses solely on the most basic prosthetic fitting, without considering the individual's vocational goals or adaptive equipment needs, fails to meet the comprehensive standard of life care planning. This oversight could lead to suboptimal functional outcomes and a failure to address the full spectrum of challenges associated with limb loss, potentially violating the CLCP duty to advocate for the individual's holistic well-being. Another incorrect approach that relies on generalized recommendations for phantom limb pain management without a specific medical evaluation or prescription from a qualified healthcare provider is ethically unsound and potentially harmful. Life care plans must be grounded in medical necessity and professional medical advice, not assumptions or generic advice. This approach bypasses essential medical protocols and could delay or impede appropriate pain management, negatively impacting the individual's rehabilitation and overall quality of life. A further incorrect approach that prioritizes cost containment above all else, leading to the selection of less durable or less functional assistive devices, would be a significant ethical and professional failing. While fiscal responsibility is a consideration, it must not compromise the efficacy and long-term benefit of recommended interventions. The CLCP primary obligation is to the individual's well-being and functional recovery, as dictated by the principles of life care planning and relevant professional standards. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the individual's medical history and current functional status. Second, engaging in open and empathetic communication with the individual and their family to ascertain their goals, preferences, and concerns. Third, consulting with a multidisciplinary team of healthcare professionals, including physicians, therapists, and prosthetists. Fourth, researching and evaluating evidence-based interventions and assistive technologies. Fifth, developing a detailed, individualized life care plan that addresses all identified needs. And finally, documenting all assessments, recommendations, and rationale in a clear and comprehensive manner, ensuring compliance with all applicable regulations and ethical guidelines. Question 14. The risk matrix shows a moderate likelihood of suboptimal functional outcomes if rehabilitation modalities are not evidence-based and cost-effective. A client with a spinal cord injury expresses a strong preference for a novel, unproven therapy that is significantly more expensive than standard, well-researched interventions. As a certified life care planner, CLCP, which approach best aligns with professional best practices and regulatory expectations for developing the rehabilitation services section of the life care plan. Option A. Recommend the novel therapy due to the client's express preference, documenting the client's request and the potential risks of not pursuing it. Option B. Recommend a combination of the novel therapy and standard modalities, prioritizing the novel therapy due to its perceived cutting-edge nature, even if it significantly increases the overall cost. Option C. Recommend standard, evidence-based rehabilitation modalities that have demonstrated efficacy and cost-effectiveness, while thoroughly educating the client on the rationale and exploring their concerns about the novel therapy. Option D. Recommend the novel therapy, assuming that client satisfaction with the chosen modality will ultimately lead to better outcomes, regardless of empirical evidence. The correct answer is A. Recommend the novel therapy due to the client's express preference, documenting the client's request and the potential risks of not pursuing it. Explanation. This scenario presents a professional challenge because the Certified Life Care Planner, CLCP, must balance the client's express preferences for specific rehabilitation modalities with the evidence-based efficacy and cost-effectiveness of those modalities, all within the regulatory framework governing life care planning. The CLCP duty is to advocate for the client's best interests, which includes recommending services that are medically appropriate, functional, and financially sustainable, while also adhering to professional standards and ethical guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that integrates the client's goals with objective clinical findings and current best practices in rehabilitation. This involves a thorough review of medical records, consultation with the interdisciplinary treatment team, and consideration of the latest research on rehabilitation outcomes. The CLCP must then translate these findings into a life care plan that recommends evidence-based modalities, justifying their inclusion based on their potential to improve function, quality of life, and reduce future care costs. This aligns with the CLCP ethical obligation to provide objective, unbiased recommendations and to ensure the plan is realistic and achievable. Adherence to the CLCP certification standards, which emphasize a systematic and evidence-based approach to life care planning, is paramount. An incorrect approach that solely relies on the client's initial requests without independent clinical validation fails to meet the CLCP professional responsibility to ensure the recommended services are medically necessary and effective. This could lead to the inclusion of unproven or inappropriate modalities, potentially resulting in wasted resources and suboptimal outcomes for the client, and a failure to adhere to the principles of evidence-based practice expected of a CLCP. Another incorrect approach that focuses exclusively on the most expensive or cutting-edge modalities, without a clear demonstration of superior functional benefit or cost-effectiveness, violates the principle of fiscal responsibility and prudent resource allocation inherent in life care planning. This could lead to an inflated and unsustainable life care plan, potentially jeopardizing the client's long-term financial security. Such an approach neglects the CLCP duty to recommend services that are both effective and economically viable. A third incorrect approach that dismisses the client's preferences entirely without adequate justification or exploration of alternatives demonstrates a lack of client-centered care. While the CLCP must ensure recommendations are evidence-based, ignoring the client's input can lead to a plan that the client is unwilling or unable to follow, undermining its effectiveness. Professional decision-making requires a collaborative process where the CLCP educates the client about evidence-based options and works with them to align their preferences with realistic and effective rehabilitation strategies. The professional decision-making process for similar situations should involve 1. Thoroughly understanding the client's medical condition, functional limitations, and personal goals. 2. Conducting an independent, evidence-based review of available rehabilitation services and modalities. 3. Consulting with the interdisciplinary treatment team to gather expert opinions. 4. Evaluating the efficacy, cost-effectiveness, and potential outcomes of recommended modalities. 5. Engaging in open communication with the client to discuss findings, explain rationale, and collaboratively develop a plan that respects their preferences while adhering to professional standards. Question 15. The performance metrics show a consistent need for life care plans that are not only current, but also demonstrate an understanding of how the profession has evolved to address the complexities of long-term care needs. Considering the historical development of life care planning, which of the following approaches best reflects a comprehensive and ethically grounded methodology for developing a life care plan today? Option A, emphasizing vocational rehabilitation and economic projections as the primary components, with minimal consideration for medical or psychosocial aspects. Option B, focusing exclusively on the most recent advancements in medical technology and therapeutic interventions, assuming these supersede all previous considerations. Option C, adhering strictly to the initial frameworks established in the early days of life care planning, without incorporating subsequent research or legislative changes. Option D, prioritizing the integration of historical methodologies and landmark legislation that shape the field, ensuring current plans are informed by past advancements and limitations in disability management and long-term care. The correct answer is D, prioritizing the integration of historical methodologies and landmark legislation that shape the field, ensuring current plans are informed by past advancements and limitations in disability management and long-term care. Explanation: the performance metrics show a growing demand for life care plans that accurately reflect the evolving understanding of long-term care needs and the historical context of disability management. This scenario is professionally challenging because it requires a life care planner to synthesize past methodologies and their limitations with current best practices and regulatory expectations. A deep understanding of the historical development of life care planning is crucial for providing comprehensive, ethically sound, and legally defensible plans. The correct approach represents best professional practice because it demonstrates an understanding that life care planning is not static, but has evolved significantly, recognizing the historical shift from purely medical models to a more holistic, biopsychosocial approach, and acknowledging the influence of legislation like the Americans with Disabilities Act (ADA) and the Rehabilitation Act is fundamental. This historical awareness informs the planner's ability to anticipate future needs, identify potential gaps in care, and advocate effectively for the individual within the current legal and ethical framework. It ensures the plan is grounded in a robust understanding of how the field has developed to address complex needs. An incorrect approach that relies solely on outdated methodologies or ignores the historical evolution of the field fails to meet current professional standards. For instance, a planner who only considers medical interventions without acknowledging the psychosocial, vocational, and environmental factors that have become integral to modern life care planning would be providing an incomplete and potentially inadequate service. This failure could lead to a plan that does not adequately address the individual's overall well-being and independence, potentially violating ethical obligations to provide comprehensive care. Furthermore, failing to consider the historical impact of legislation and advocacy on disability rights and access to services could result in a plan that is not legally sound or fails to leverage available resources and protections. Professionals should approach this by first understanding the foundational principles of life care planning as they have evolved. This involves researching the history of the profession, including key legislative milestones, seminal research, and shifts in professional consensus regarding best practices. When developing a life care plan, professionals should critically evaluate how historical approaches might inform or limit current recommendations, ensuring that the plan incorporates the most current, evidence-based practices and addresses the full spectrum of an individual's needs within the contemporary legal and ethical landscape. This requires continuous professional development and a commitment to understanding the lineage of their practice. Question 16. Compliance review shows a certified life care planner, CLCP, has been retained by an attorney in a personal injury case. The attorney has instructed the CLCP to ensure the life care plan includes a significant buffer for future medical expenses and services, stating that we need to ask for everything possible to maximize the settlement. The CLCP has conducted an initial assessment and believes some of the attorney's requested inclusions are not medically necessary or are excessively costly based on standard care guidelines. What is the most appropriate course of action for the CLCP? Option A. Include all requested items and inflate costs as instructed by the attorney to maximize the potential settlement, assuming the attorney will handle any discrepancies during negotiations. Option B. Refuse to proceed with the life care plan development, citing the attorney's instructions as an insurmountable ethical conflict, and withdraw from the case immediately. Option C. Develop the life care plan based on an objective, evidence-based assessment of the client's needs, utilizing established methodologies and expert consensus, and then professionally communicate the findings and rationale to the attorney, explaining why certain requested items are not included or are adjusted based on professional standards. Option D. Proceed with the life care plan development as requested by the attorney, but add a disclaimer to the report stating that the plan was developed under specific instructions and may not reflect an objective assessment of needs. The correct answer is C. Develop the life care plan based on an objective, evidence-based assessment of the client's needs, utilizing established methodologies and expert consensus, and then professionally communicate the findings and rationale to the attorney, explaining why certain requested items are not included or are adjusted based on professional standards. Explanation. This scenario presents a professional challenge due to the inherent conflict between advocating for a client's needs and maintaining professional objectivity and adherence to legal standards. The Certified Life Care Planner, CLCP, is tasked with developing a plan that accurately reflects the client's future care requirements, but the pressure from the attorney to inflate these needs for litigation purposes compromises the integrity of the plan and the planner's ethical obligations. The correct approach, which involves a thorough and objective assessment based on established methodologies and evidence, represents best professional practice. This aligns with the CLCP ethical code and the foundational principles of life care planning, which mandate unbiased, evidence-based recommendations. Specifically, the CLCP must adhere to the standards of practice for life care planning, which emphasize the use of reliable data, expert consensus, and a systematic approach to forecasting future needs. This ensures the plan is defensible in court and serves the client's best interests by providing a realistic and comprehensive roadmap for care, rather than an inflated projection designed solely for litigation advantage. An incorrect approach, such as capitulating to the attorney's pressure to inflate costs or services without objective justification, constitutes a significant ethical and regulatory failure. This violates the CLCP duty of integrity and objectivity, potentially leading to a fraudulent or misleading document. Such actions undermine the credibility of the life care plan and the planner, and could have serious legal repercussions for both the planner and the client. Furthermore, it breaches the trust placed in the CLCP by the court and other parties involved in the legal process. Another incorrect approach, such as refusing to engage with the attorney's concerns or dismissing them outright without attempting to understand the basis of their request, demonstrates a lack of professional communication and collaboration. While maintaining objectivity is paramount, a failure to engage in a professional dialogue about the scope and justification of care needs can lead to misunderstandings and an adversarial relationship, potentially hindering the effective representation of the client. The professional decision-making process in such situations requires a commitment to ethical principles, a thorough understanding of the relevant legal and professional standards, and the ability to communicate effectively with all parties involved. The CLCP must prioritize objective assessment, document all findings meticulously, and be prepared to defend their recommendations based on evidence and established methodologies. Even when faced with pressure to deviate from these principles. Question 17. Operational review demonstrates that a 78-year-old client, diagnosed with mild cognitive impairment, reports being able to independently manage all aspects of their personal finances, including paying bills, budgeting, and balancing a checkbook. However, a review of recent bank statements by a concerned family member revealed several missed bill payments and unusual, large cash withdrawals. When asked directly about these discrepancies, the client becomes defensive and insists everything is under control. Which approach best reflects the certified life care planner's responsibility in assessing this client's instrumental activities of daily living (IEDL) related to financial management? Option A. Accept the client's self-report of financial independence as the primary determinant of their IEDL capacity, given their insistence on managing their own affairs. Option B. Rely solely on the family member's interpretation of the bank statements to conclude that the client is incapable of managing their finances independently. Option C. Conduct direct observation of the client attempting to pay a bill or manage a budget. Interview the client using a structured questionnaire about financial management tasks, and interview the concerned family member to gather specific examples of financial difficulties and the client's responses. Option D. Assume that because the client can verbally articulate the steps involved in paying bills, they possess the necessary cognitive and executive functions to manage their finances without further assessment. The correct answer is C. Conduct direct observation of the client attempting to pay a bill or manage a budget. Interview the client using a structured questionnaire about financial management tasks, and interview the concerned family member to gather specific examples of financial difficulties and the client's responses. Explanation. This scenario presents a common challenge in life care planning, accurately assessing an individual's capacity to perform instrumental activities of daily living, IEDL, when their reported abilities differ from observed behaviors or collateral information. The professional life care planner must navigate subjective self-reporting, potential cognitive or physical limitations affecting perception, and the need for objective evidence to support recommendations. Challenge lies in balancing respect for the individual's autonomy with the ethical and regulatory obligation to provide a comprehensive and accurate assessment that forms the basis for future care planning and resource allocation. The correct approach involves a multifaceted assessment that triangulates information from various sources. This includes direct observation of the individual performing or attempting to perform IEDL, structured interviews with the individual, and interviews with reliable collateral sources such as family members, caregivers, or healthcare providers. This comprehensive method aligns with the Certified Life Care Planner (CLCP) standards, which emphasize thoroughness, objectivity, and the use of validated assessment tools where appropriate. By gathering diverse data points, the planner can identify discrepancies, explore underlying reasons for them, e.g., memory deficits, physical pain, learned helplessness, or a desire to appear more independent, and arrive at a more accurate determination of functional capacity. This approach ensures that the life care plan is based on a realistic understanding of the individual's needs, promoting safety, quality of life, and appropriate resource allocation, thereby fulfilling the planner's professional and ethical duties. An incorrect approach would be to solely rely on the individual's self-reported ability to manage finances. This fails to acknowledge that individuals with cognitive impairments, such as executive dysfunction or memory loss, may genuinely believe they are managing their finances effectively when they are not, or they may be unwilling to admit to difficulties due to pride or fear. This approach violates the CLCP standard of conducting a comprehensive assessment and risks overlooking critical safety concerns and financial mismanagement, potentially leading to exploitation or significant financial hardship. Another incorrect approach is to exclusively accept the observations of a single family member without independent verification. While family members can provide valuable insights, their perceptions can be influenced by their own biases, emotional involvement, or a desire to have the individual remain at home, even if it compromises safety. This selective reliance on information bypasses the need for objective assessment and can lead to an inaccurate portrayal of the individual's IEDL performance, potentially resulting in an inadequate or inappropriate care plan. A third incorrect approach is to assume that because an individual can verbally describe the steps involved in meal preparation, they are capable of independently performing all aspects of this IEDL. This overlooks practical challenges such as planning, shopping, safe food handling, cooking, and cleaning up. A functional assessment requires observing the actual performance of the task, not just the cognitive understanding of it. Relying solely on verbal descriptions can lead to an overestimation of independence and a failure to identify the need for assistance with crucial aspects of meal preparation, impacting nutrition and health. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the specific IEDL in question. 2. Gather information from multiple sources, the individual, collateral contacts, and direct observation. 3. Use standardized assessment tools or structured interview guides to ensure consistency and completeness. 4. Actively seek to understand discrepancies between reported and observed abilities. 5. Document all findings meticulously, including the methods used for assessment and the rationale for conclusions. 6. Formulate recommendations based on the totality of the evidence, prioritizing the individual's safety, well-being, and quality of life. Question 18. Assessment of a certified life care planner's ethical obligations arises when they discover a close personal friendship with a key stakeholder in a case they are currently evaluating. This friendship, while not directly financial, could potentially influence their perception of the stakeholder's needs and the recommendations made in the life care plan. What is the most ethically sound approach for the CLCP to manage this situation? Option A. Inform the client of the friendship but assure them that it will not impact the plan, and continue with the assessment without further consultation. Option B. Proceed with developing the life care plan as usual, assuming their professional judgment will not be compromised by the personal friendship. Option C. Immediately disclose the personal friendship to the client and relevant parties, and consult with a supervisor or ethics committee to determine the best course of action, which may include recusal or implementing specific safeguards to ensure objectivity. Option D. Withdraw from the case immediately without any disclosure or explanation to the client or other parties involved. The correct answer is C. Immediately disclose the personal friendship to the client and relevant parties, and consult with a supervisor or ethics committee to determine the best course of action, which may include recusal or implementing specific safeguards to ensure objectivity. Explanation. The scenario presents a common ethical challenge for certified life care planners, CLCP, involving potential conflicts of interest and the duty to maintain professional objectivity. The planner must navigate the delicate balance between advocating for the client's needs and ensuring the integrity of the life care plan, especially when a close personal relationship might influence professional judgment. The core of the challenge lies in upholding the CLCP ethical obligations to provide unbiased, evidence-based recommendations that serve the client's best interests, free from undue personal influence. The correct approach represents best professional practice because it prioritizes the CLCP ethical duty of objectivity and avoidance of conflicts of interest, as mandated by professional standards and ethical codes governing life care planners. By disclosing the personal relationship and seeking guidance or recusal, the planner demonstrates a commitment to transparency, integrity, and client welfare. This proactive measure safeguards the client from potentially compromised recommendations and protects the planner's professional reputation and the credibility of the life care plan. It aligns with the principle of acting in the client's best interest above all else and maintaining public trust in the profession. An incorrect approach that involves proceeding with the plan without disclosure or consultation fails to uphold the ethical standard of avoiding conflicts of interest. This can lead to a perception of bias, even if unintentional, and may result in recommendations that are not solely based on the client's objective needs. Such an action violates the CLCP responsibility to maintain professional independence and can erode client trust and the validity of the life care plan. Another incorrect approach, such as immediately withdrawing from the case without exploring alternatives, might be overly cautious and not always in the client's best interest if the conflict can be appropriately managed. While recusal is an option, it should be considered after exploring less disruptive solutions that still ensure objectivity, such as consultation with a supervisor or ethics committee. This approach fails to consider the potential disruption to the client's care continuity and the planner's established rapport, which could be beneficial if the conflict is managed ethically. A further incorrect approach, such as downplaying the significance of the personal relationship, is a direct violation of the ethical duty of honesty and transparency. Minimizing or ignoring a potential conflict of interest is professionally unacceptable and can lead to severe ethical breaches and damage to the client's trust and the planner's reputation. The professional decision-making process for similar situations should involve a systematic evaluation of potential conflicts of interest. This includes identifying the nature and extent of the relationship, assessing its potential impact on professional judgment, and consulting relevant ethical codes and guidelines. The planner should then consider a range of options, prioritizing transparency, objectivity, and the client's best interests. This might involve disclosing the relationship to the client and relevant parties, seeking advice from a supervisor or ethics committee, implementing safeguards to ensure objectivity, or, if necessary, recusing oneself from the case. The ultimate decision should be documented and clearly justifiable based on ethical principles and professional standards. Question 19. Comparative studies suggest that the most effective life care plans for geriatric individuals are those that are adaptable and client-centered. Considering the regulatory framework for certified life care planners, CLCP, in the United States, which of the following approaches best exemplifies adherence to these principles when developing a life care plan for an aging client with a history of chronic conditions? Option A. Relying solely on generalized geriatric care protocols and average cost projections without detailed individual assessment or consideration of the client's specific wishes. Option B. Focusing exclusively on the most aggressive potential future medical interventions and associated costs, assuming a worst-case scenario for all chronic conditions. Option C. Developing a plan based primarily on the recommendations of a single specialist physician, without independent verification or consideration of the client's broader needs and financial realities. Option D. Prioritizing the exploration of all potential funding sources, including government benefits and private insurance, while thoroughly assessing the client's current functional capacity and personal preferences for future care settings. The correct answer is D. Prioritizing the exploration of all potential funding sources, including government benefits and private insurance, while thoroughly assessing the client's current functional capacity and personal preferences for future care settings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a life care planner to balance the evolving medical needs of an aging individual with the practicalities of long-term care funding and resource availability, all while adhering to the specific regulatory framework governing certified life care planners, CLCP, in the United States. The complexity arises from the need to anticipate future care requirements, which can be unpredictable in geriatric populations, and to ensure these plans are both comprehensive and compliant with relevant U.S. laws and professional guidelines. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment of the geriatric client's needs, integrating current medical status with projected functional decline and potential future health events. This aligns with the CLCP Code of Ethics and Standards of Practice, which mandate thorough evaluation and planning that is client-centered and evidence-based. Specifically, it emphasizes the importance of considering the client's preferences, family support, and available community resources, while also ensuring the plan is financially feasible and legally sound within the U.S. healthcare and insurance landscape. This approach ensures the life care plan is a dynamic document, adaptable to changes in the client's condition and the regulatory environment. Incorrect approach is analysis, an approach that solely focuses on the most severe potential future medical conditions without considering the client's current functional status and preferences would be ethically flawed. It fails to acknowledge the individual nature of aging and can lead to an overly aggressive or inappropriate care plan, potentially causing undue distress or financial burden. This violates the principle of client-centered care and the requirement for a realistic and tailored plan. An approach that neglects to explore all available funding sources, including Medicare, Medicaid, private insurance, and personal assets, would be a significant regulatory and ethical failure. CLCP are expected to provide comprehensive financial planning within the life care plan, and overlooking potential benefits or resources is a disservice to the client and their family. This could lead to an unachievable care plan and potential legal ramifications for the planner. An approach that relies on generalized geriatric care guidelines without specific client assessment would be unprofessional. While general guidelines are useful, each individual's aging process and health trajectory are unique. Failing to conduct a thorough, individualized assessment and tailor the plan accordingly is a breach of professional duty and could result in a plan that is ineffective or even detrimental to the client's well-being. Professional reasoning. Professionals should approach geriatric life care planning by first establishing a clear understanding of the client's current health status, functional abilities, cognitive function, and psychosocial situation. This involves comprehensive interviews with the client, family, and relevant healthcare providers. Next, they must project future needs based on evidence-based geriatric principles and the client's specific risk factors, considering potential medical events, functional decline, and the need for various levels of care. Simultaneously, a thorough financial assessment is crucial, identifying all potential funding streams and estimating long-term costs. The plan must then be developed collaboratively, incorporating the client's preferences and values, and ensuring it is realistic, achievable, and compliant with all applicable U.S. federal and state regulations, including those related to healthcare, insurance, and elder law. Regular review and updates are essential to maintain the plan's relevance and effectiveness. Question 20. The control framework reveals that a certified life care planner, CLCP, is tasked with developing a life care plan for a claimant in a workers' compensation case. The claimant's attorney is advocating for a plan that includes extensive, potentially speculative future interventions, while the employer's representative is pushing for a more conservative plan focused on immediate, basic needs. Which approach best upholds the CLCP professional responsibilities and the integrity of the life care plan in this legal setting? Option A. Prioritize the claimant's subjective reports and the attorney's recommendations for extensive future interventions, as the claimant's advocate is best positioned to understand their needs. Option B. Focus primarily on the employer's cost containment objectives and recommend only the most basic, immediate care services to minimize financial exposure for the employer. Option C. Conduct a comprehensive, evidence-based assessment of the claimant's past, present, and future medical and vocational needs, utilizing objective medical documentation, expert opinions, and recognized standards of care to project future costs and services, while maintaining strict neutrality. Option D. Selectively include only easily quantifiable and readily available services, omitting complex or less common, but potentially necessary interventions to streamline the planning process. The correct answer is C. Conduct a comprehensive, evidence-based assessment of the claimant's past, present, and future medical and vocational needs, utilizing objective medical documentation, expert opinions, and recognized standards of care to project future costs and services, while maintaining strict neutrality. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Life Care Planner, CLCP, to navigate the intersection of healthcare needs and legal proceedings, specifically in a workers' compensation context. The CLCP must maintain objectivity and adhere strictly to established standards of practice, while providing information that will be used to determine compensation and future care. The potential for bias, either intentional or unintentional, from either the claimant's advocate or the employer's representative, necessitates a robust and defensible methodology. The CLCP report directly impacts the financial and medical well-being of the injured worker and the financial obligations of the employer, demanding a high degree of accuracy, thoroughness, and ethical integrity. Correct approach analysis. The correct approach, which involves a comprehensive, evidence-based assessment of the claimant's past, present, and future medical and vocational needs, directly aligns with the CLCP professional responsibilities and the regulatory framework governing life care planning in legal settings. This approach ensures that the life care plan is grounded in objective medical documentation, expert opinions, and recognized standards of care. It prioritizes the claimant's long-term well-being by projecting future costs and services accurately, thereby fulfilling the ethical obligation to provide a plan that is both realistic and comprehensive. Adherence to established life care planning standards, such as those promoted by professional organizations and implicitly required by legal frameworks that rely on expert testimony, ensures the plan's defensibility in legal proceedings. This method upholds the CLCP role as an objective expert witness. Incorrect approach is analysis. An approach that solely relies on the claimant's subjective reports without independent verification or objective medical assessment fails to meet the standards of a defensible life care plan. This is an ethical failure as it prioritizes anecdotal evidence over objective data, potentially leading to an inflated or inaccurate plan. It also violates the principle of providing an unbiased assessment, as it is susceptible to the claimant's potentially biased narrative. An approach that prioritizes the employer's cost containment goals over the claimant's documented medical needs is also ethically and professionally unacceptable. The CLCP primary duty is to assess the claimant's needs based on their injury and prognosis, not to serve the financial interests of the employer. This approach represents a conflict of interest and a failure to uphold the professional standard of advocating for the claimant's appropriate care. An approach that selectively includes only readily available or easily quantifiable services, while omitting complex or less common but medically necessary interventions, is a failure of thoroughness and comprehensiveness. This can lead to an incomplete life care plan that does not adequately address the claimant's future needs, potentially resulting in significant out-of-pocket expenses for the claimant or inadequate care. This violates the professional obligation to provide a holistic and forward-looking assessment. Professional reasoning. When faced with conflicting pressures or incomplete information in a legal setting, a CLCP should always default to a systematic, evidence-based methodology. This involves meticulously gathering all relevant medical records, obtaining expert opinions where necessary, conducting a thorough functional assessment, and projecting future needs based on established medical literature and recognized standards of care. The CLCP must maintain strict neutrality, documenting all sources of information and the rationale for each projected need and cost. If faced with pressure to deviate from these standards, the CLCP should clearly articulate the professional and ethical requirements of their role and refuse to compromise the integrity of the life care plan. The decision-making process should be guided by the principle of providing an objective, comprehensive, and defensible assessment that accurately reflects the claimant's future care requirements.